Hello and welcome to The Nation. I'm Jared Ratnam. Have you ever heard of a gut feeling or butterflies in your stomach? Well, now these sensations emanating from your belly suggest that your brain and gut are apparently connected. Now what's more is recent studies show that your brain affects your gut health and your gut may even affect your brain health. Now here's yet another question. Have you heard of IBS? Well, if you don't know what IBS is, let us let you in on it with a little video. Let's play this video and we'll come back and talk about the brain-gut connection.
Yes, IBD. I'd be confused too, if I were you. So why are we talking about IBS anyways? Well, because it's a common condition that affects the colon. And I'm pretty sure, if not yourself, you will know somebody who's got the symptoms or even this label on them. Now, what is IBS really? IBS stands for irritable bowel syndrome. What it's not inflammatory bowel disease. That we'll discuss another time. IBS. What symptoms can you get with it? It's often associated with abdominal pains, bloating, sometimes diarrhea, constipation, sometimes alternating between the two. It's often more significant or often more severe at the end of the day, but it's never at night. Important fact. What causes it? Well, it's basically the function of your colon has been disrupted for whatever reason. It could be the colon is contracting too long too tightly, leading to diarrhea. It could be too lax, leading to constipation. It could be the nerve endings of your colon firing too early, leading to more pain with little gas accumulation. Or even a consequence of a diarrheal illness leading to post-infective IBS. And very commonly, it is a disruption of your bacterial balance. For example, too much sugar in your diet. Often triggers are stress and the type of food you have. So if you actually have IBS, addressing the stresses in your life or work is very important. The types of food you have will play a significant role. For example, gas-producing food will do a number on you. For an example of that would be cabbages, produce lots of gas. That doesn't mean you don't eat vegetables. Certain foods will trigger it and certain will help. For example, an apple may not be the best one for you, but you should try it. A diet that can be very helpful in IBS is the FODMAP diet. If these simple measures don't work, then we can move towards medication. Things like rifaximin for the diarrheal type of IBS, linaclotide for the constipation type, or even amitriptyline to address hyperfiring of the nerve endings on your colon. Important to note that IBS is often a diagnosis of exclusion, meaning nothing else is there. Things that are not associated with IBS.
Well, if you want to know more about that, go to drprabjot.com. We'll super that on the screen for you later on. But the communication system between your gut and brain is called the gut-brain axis. Joining me on The Nation is Dr. Prabjot Singh, a much sought after gastroenterologist right here in the Federal Capital. Thanks for joining us on the show. Good to have you back again.
Thanks.
No, it's really odd. No, every time you start the show, off the show, off the airwaves, we're talking like we're shooting the breeze, and then when we get on, just to get that conversation started, it takes a while.
Yeah.
But the reason I brought you in was to talk about this gut-brain connection. Now, everyone's talking about it. Everyone's approximating, things about it. But what is really the whole gut-brain connection, bro?
Well, it's quite new, really. Actually, it's a new developing field, so we know a lot, but a lot we do not know. Effectively, we know there is a link. The gut and the brain is connected. It sends signals back and forth. It goes both ways, which is how all this came about. Is, for example, in the past, people with encephalopathy, alcohol-inducing encephalopathy, and you give them antibiotics, you treat the gut, and yet and they get better, they get more conscious, they recover. And then people with probiotics, their depression disappears. Studies on mice and things show that you change the gut bacteria and their behavior changes. Mm-hmm. There is a definite link. How it's linked, many different ways.
Okay, let me tell you how. The vagus nerve and the nervous system. Tell us about that.
Well, vagus nerve is just
and if you're
one.
going to use big words, please explain that to us.
Okay.
Yeah.
All right.
Yeah.
So the way the brain affects the gut is many different ways. Stress, the amount of cortisol that's produced will disrupt the bacterial balance. The vagus nerve is like a train track, a wire that goes from the gut and back up, goes both ways.
Mm-hmm.
But
there it is.
Yes, yes. As you can see, it's very complicated, and it affects the whole GI system. Look, it's
Like
not
my
just in the stomach.
relationships.
If, well, there you go.
Yeah.
But it affects everything. But that's not just the only way it works. Though it's the most prominent. Also, your immune system can affect your brain. Your hormonal activities can change it as well. But the vagus nerve is the most prominent one we know most about, and how that disruption. For example, if you have depression, you can cause inflammation in your gut via the vagus nerve. Any inflammation down there can go back up that way, which is kind of going back to what this IBS thing I was talking about before, that stress will trigger a system of chain reactions that will disrupt your GI tract, your gastrointestinal tract, your gut, and then you get all sorts of symptoms from diarrhea, constipation.
Yeah, but I guess the big problem here is which way is it a one-way street? Is it from the head to the gut, or the gut back to the head? No,
it's both ways. Now,
has this been proven?
Yeah, on studies, not exactly saying, right, we do something and then we see this thing happen over there, but more along the lines, mostly animal studies, that we change the gut bacteria, give them probiotics and things like that, the behavior changes. In people who have depression, even there are studies showing that people in depression that are not getting better antidepressants, you give them probiotics, you give them things to address their gut bacteria, and they improve.
Well, what are people in the psychiatric field saying about this? Because the last time I spoke to you, you said you are not a big advocate of probiotics and prebiotics.
Okay, so the way about probiotics, prebiotics is not one for everybody. You don't just take, everybody should take probiotics, prebiotics. I also understand what a probiotic is. Effectively, if you are missing something, the probiotic will give you something that you're missing. A prebiotic will just increase what you have. So, in this respect, if your gut has the good bacteria, you give a prebiotic, it will increase the number of it, the biodiversity, just more of the same. You have a probiotic, you get more variety. Same effect can be achieved by doing intermittent fasting as well. Or in fact, having more fruit and veg in your diet and a more plant-based diet can increase biodiversity. Probiotics are good in certain situations.
Right, but you're opening another can of worms also. If you talk about intermittent fasting, there's a lot of different opinions on that, but we won't go there.
Okay,
let's come back to this first.
Now, one thing I will say about intermittent fasting, it works more effectively if you fast at night. And that's evidence-based as well. It's not someone's point of view.
So if you fast at night, but if you're suffering from gastritis, or if you have your GERD problems,
best get them addressed first before you go down.
So you
shouldn't. Get some normality first before you increase.
So the reason why I want to talk about this today is simple. Everyone's talking about it. It's now the new buzzword in the news, in the media. Everyone's talking about mental wellness. You know, have a sense of wake up, do something. You know, everyone's giving you very cliche, what do you call that? Advice and tips. So I really want to know what we can do because I really know that the gut plays a very important role in all this.
It definitely does. Yeah.
So with all this, what are we missing with regards to the head-gut connection?
Okay, so if we focus more, well, first to get out of the way is from the head to the gut. That can be primarily your IBS and gastritis thing. The stress will increase more acid production because of the cortisol levels, the normal steroids. It affects the gut, causing IBS, all the stuff we just mentioned. But if we go from the gut up to the brain,
what are we looking at here?
Yeah, so this is the cycle, both ways around. Stressed out is going to affect the gut, and then the gut dysbiosis, that means the microbiota, which means the gut bacteria is disrupted, it affects your brain. So in this respect, with this current circumstance we're in with COVID and everything going on, everyone's stressed out, everyone's worried about different things, but what can you do that can actually affect change with regards to the gut? Well, firstly, never underplay sleep. Sleep's important. Okay. The type of food you eat is very important. High sugary food, high fat food is bad. Processed food is bad. What food is good for you? Fiber. Why is fiber good? Because fiber is the food your gut bacteria needs, and it will produce the short chain fatty acids that your body needs to send good signals, and this will actually improve your mood. Don't get me started on this sort of thing, but I will say this, that the gut bacteria can actually produce neurotransmitters that release serotonin and GABA and all, which is sort of the happy hormones kind of thing, make you feel better.
Right.
And all you got to do is actually eat more fiber. Where's the fiber? Actually, most fiber is in nuts, but plants, whole foods. If you really need probiotics, have it, but eat good, wholesome food.
Yeah, the reason why we've gone, when we talk about the gut and mental well-being, every time you walk into a pharmacy, everyone's throwing probiotics at you.
Of course.
All the time.
Yeah.
And this, everyone now thinks that, it's a default thing to have a probiotic bottle at home.
Yeah.
Now
it's not. It's not. I mean, the evidence for most of probiotic work were done on children. Most of the evidence are there for antibiotic-induced diarrhea. That means if your diarrhea is going to be last 7 days, maybe it'll last 5 days this time. Bloating, it can help.
But they also say that probiotics help with H. pylori and stuff like that. Okay, and having said that, you go to the pharmacy and they flat out tell you, okay, for those of us who are not sure what H. pylori is, it's a bacteria. Yeah?
Yes,
yeah.
indeed,
Yeah. It was discovered by Australians and they won a Nobel Prize for it. And these are the things that are causing gastritis and gastrointestinal problems.
Not only that, but H. pylori is associated with gastric cancer. In Japan, they had a big problem with gastric cancer until they had an eradication program of H. pylori, and gastric cancer rates just dropped. So having H. pylori is not a small thing.
Right.
But the evidence as to a probiotic working towards that is not very strong. So should you buy it? Should you not? I mean, you would know a lot.
Sometimes I wonder if we have H. pylori in our politics in Malaysia. I don't know. You need to go down that gut and check that. But we also came up with a special segment. I'd like to call this the dispensary, because we in Malaysia, if there's one thing I realize, we in Malaysia, me included, we are always looking for that special pill. My happy place has always been the pharmacy. Then we come to you for miracles. Short of walking on water, we expect nothing less. So this part is called the dispensary, and in the dispensary, we're going to talk a little bit about medication that you buy off the counter, medications that are meant to be prescribed. Okay, and this is something I have a problem with when we talk about medication. So we're talking about now a brand you've heard before, Motilium and Ganaton. And they are by nature, hang on, I'm trying to look for the notes here. They are prebiotics. Okay, so Motilium versus Ganaton, prokinetic drugs. Okay, tell us what prokinetic drugs does.
Effectively,
because when you go to pharmacy, they're giving you stuff like this.
Of course. Okay. I mean, before you buy a drug, you need to know why you're taking it and avoid drugs if possible. But prokinetic drugs basically helps empty your stomach. That's all it does. So if anything's going to sit there and irritate it longer, it'll just clear it out, and hence less.
So that's Motilium. Can we drag the picture up of Ganaton? So they are both prokinetic drugs. They do about the same thing.
Indeed, yeah. And so which one you're going to pick? I would go for Ganaton purely because domperidone has got some association with cardiac dysrhythmias and things like that. So don't simply take a drug if you don't need to. Ganaton is fairly similar to something else called...
So Ganaton is the other drug. If you can have the picture of Ganaton, the other drug, that so this is Ganaton.
Yeah, it's as far as I'm concerned, it's a bit safer than domperidone, though the chance of anything going wrong is low anyway. But pick the safest one if you have to.
But what if someone came up to you and say, "Hey, why are you so biased against?"
I'm not biased. It's just personal choice. If you prefer one or the other, by all means go for it. If one works better for you, go for that.
So they give you your PPIs, they give you your omeprazole or something, and they'll give you this. And this is basically a prokinetic drug, is to empty the stomach.
Indeed,
Okay, but they also say that if you have nausea or if you're nauseous and not feeling well, they also give you stuff like this.
Well, you shouldn't just take stuff just because you have a symptom. You need to know why. I mean, is your nausea related to an infection? Then you need antibiotics. Is it related to reflux? Then maybe a PPI will be better. Not just willy-nilly, I'll just take my Ganaton again. You're just trying to address a symptom. You'll never get anywhere. You need to find the cause.
Right. So two other things that we usually buy off the counter, and this we buy this more than Kwachi these days. It's called Gaviscon and Melox, and these are things we get over the counter. and everyone takes it like they know what they're doing with it. So this is Gaviscon. Tell us what we need to do with this.
Well, look, I mean, Gaviscon.
Kalau sakit gastric, you makan ni je, okay.
Yeah, well, it'll get better for a short while.
For a short while,
But
okay.
Gaviscon, the best way to describe it is like this. When you look at the sea and the waves hit, it all splashes up. But Malaysian seas are not clean and nothing splashes up. It just goes up and down, right? Okay, so that's Gaviscon. It forms a float, so less chance of anything flying back up. It also tries to neutralize the acid and things, and it addresses what we call the acid pocket that you have at the top. So it's a good drug, but it doesn't work a long time. And how is that different from something like Melox, for example?
Right.
Melox has a component to it which has got simethicone that helps decrease the size of the gas bubbles. So they work differently. They're both very effective. But it really depends on your symptoms. If you tell me, look, I'm feeling a lot of air, I'm bloating a lot, this might be better. But if you're getting, more heartburn kind of thing, then perhaps
Okay, so
Gaviscon might suit you.
let's break it down. So the prokinetic tablets, which you should be getting a prescription from the doctor,
Yes.
which you can also buy from the pharmacy. I don't know why the debate is still ongoing as to prescription pills being sold at the pharmacy. But with prokinetic pills and what do you call it, Melox and Gaviscon, for what do you take what?
Okay, so if you have simple heartburn and reflux, or you ate something wrong and exacerbated, Melox or Gaviscon can help you. Once or twice, try it. If you're better, good. If you're not, you need to see a doctor. Prokinetic medicines, you should not be taking it willy-nilly. No, you should be given it as a patient.
Willy-nilly, did you hear that?
Yeah, don't take it willy-nilly. No.
Don't take it willy-nilly.
No.
So two other medicines I'd like to talk about is something which we use for sakit perut. Sakit perut, the doctor will give you this. It's called Buscopan, or the other one is called Duspatalin. We take it. The doctor bagi untuk sakit perut, but we don't know what this all is. Yeah. I'm sure you've seen this. I'm sure you've bought this off the shelves in the pharmacies too. So tell us what this is about.
They're different drugs, but they do kind of the same thing. They stop the intense spasms that you get. Now, you gotta ask yourself why you're taking this in the first place. If you get a pain, a spasmodic cramping,
like a
a twist, a really tight twist, and it can be quite severe. People can even collapse with this. But why is the spasm happening? Is it because you're constipated? Do you have too much air on board? And if that's the case, you need to know why. Or is your body trying to expel any bad stuff, any bacteria? Like if someone's got diarrhea and vomiting, again, horrendous diarrhea, they're going to get a lot of these cramps.
Right.
But it's the body's way of getting rid of the bugs. And if you stop it, is that really the best thing? You want the bugs out. But of course, if it's really bad, then take it and help. Right. But you need to know why you're taking this and why the symptoms are there before you start it. But effectively, it works on the spasmodic contractions. It relaxes it. It's not a cure. It deals with the symptom.
So basically, when you look at your gut, your gut problems, if you have a gut problem, and
Most
you
Malaysians
feel,
do.
yeah.
Almost everyone does. Whether they admit to it or not, I'm certain everyone's got a gut problem. So
you're sitting alone and you feel your stomach or your lower gut has a brain of its own. It starts moving. That's sort of telling you that you might be having IBS, isn't it? Yeah. So once again, going back to the brain-gut connection. So you said you need to not eat fatty food, stay away from the sugars.
Yeah.
People who watch programs like this say, tell us something we don't know.
About for IBS or the brain gut per se?
Brain gut, IBS, anything. Yeah.
Okay, fine. So if one thing I would say you take away from all this, don't rush for medicines. In fact, address your food. Okay, Malaysia is full of fantastic tasting food, but it's the worst for us.
Satay is not very good these days.
No, I love satay, but yes, I agree. It's not very good these days. But the quality of food, it's not the quantity. The best thing you can do is incorporate more plants into your diet. And plants don't mean fruit and veg. It means also nuts, seeds, legumes, dals, all these sort of things. But of course, if you have broccoli and you deep fry it, it's pointless. If you have dal and you add all the ghee on top, pointless. Oils and sugars are the bad ones, but apart from that, increase the plants. I'm not telling you to stop anything else. And these plants are the fibers you need, is the food for your gut. And the healthier your gut is, the brain-gut axis will kick in, and the healthier you will be. You feel better. But I'm not saying you have to be vegetarian or vegan or don't do stuff like that, because vegans have their own share of problems. They get deficiencies in B12, iron absorption can be poor. That has its own share of problems.
Yeah, but when you say deficiency in B12 and irons can be, I've never gone to a doctor or seen a doctor who'll say, okay, let's do a test, blood work to see if you have enough vitamins and minerals in your body.
Because everybody assumes you have a normal varied diet, otherwise you would not have reached this age. I normally ask people what they eat. I normally ask them if they're vegetarian or vegan as standard, because it gives me a starting point as to what your diet may be. I ask them about their habits, their number of meals a day. If they work night shifts, do they consider when they wake up as breakfast, or when they wake up it's still dinner? Because that's very important as well. And it should always start. I mean, you are what you eat, as they say.
You are. Having said that, now for those of us in our 40s or 50s, you know, they always say you need to go out there, get a scope done. Or what's the word on this?
All right. Well, what do you mean, like a colonoscope?
A colonoscope or a
gastroscope. A
Yeah.
gastroscope. There are certain countries have their own rules. Japan, you have to do it every year. Malaysia, there's no strict rules for it. A colonoscope depends on your risk factors. High risk, of course, you get it earlier. But as standard, it will be about 50 and 45 for some countries as well. They moved it down because of risk of colon cancers, and it can be prevented. Colon cancer is third commonest cancer in men and second for women, so you should not downplay. A quick scope is not a terrifying procedure in any way, shape or form. Right. But on the flip side, don't go rushing and ask for a scope every 2 years. It's the wrong thing to do.
Yeah. Well, you know, here's a very interesting thing about medicines. Like PPI has been used for the longest time. You had your Losec, which is now known as omeprazole. You are off the shelves, you get generics, just so many different kinds of generics coming from Canada, from Japan, from India, whatever. But having said that, there are other classes like pantoprazole, there's omeprazole, pantoprazole, rabeprazole, the list goes on.
Sure.
Having said that, is that the only arsenal gastroenterology has?
Okay.
After so many years, we're still using the same old drugs.
Well, you mean with regards to gastritis?
Yeah.
Okay, look, these drugs work to reduce the amount of acid that's produced, and your stomach has to heal by itself. There are other drugs out there, but you need to know why you're getting the symptoms. For example, if your gastritis is because of a motility issue, suppressing your acid is not going to make much. I need to give you something like Ganaton, for example. If it is your reflux because of the valve being loose, then addressing the valve with regards to procedures like Stretta procedure will address that. So it's not, is that our arsenal? That's the best drugs we got for too much acid production. Of course, there's new ones that have come out that's a different class altogether, something called vonoprazan, but that's been touted more towards H. pylori eradication and severe esophagitis rather than gastritis per se. Although the way it works is not the same, but it can help in the same manner. But really, you need to know what the cause of your problem is. For example, if your thyroid is underactive, you're more than likely going to get gastritis. Why? Not because the acid production is more, it's because the motility is poor.
Right. My studio director was asking if down ketum is okay for this.
Down ketum?
Yeah, it kind of relaxes.
I don't even know what down ketum is.
It kind of gives you a bit of a buzz, but
okay.
And does it relax the
Well,
stomach?
look, if it goes back to brain-gut barrier, if you're feeling good, you're going to feel good. I guess it could
but
work
we're
that
not
way.
promoting drugs.
No. I don't even know what down ketum is.
No, but having said that, with all that's going on, you know, what's your advice to Malaysians now who I more than ever need to, clear their heads and also, mend their gut?
I mean, stick to the basics. You know, have your breakfast, have your lunch, have your dinner. The healthier food you eat, the more whole food, it will help with your gut balance. It will help with weight loss. It will help with your mood, with any depression. And plus, if you have all this time sitting at home, learn to cook.
Learn to cook. That's a really good idea. But one last question I have for you, and this is the $1 million question.
Yeah.
Okay, so for a while there was a lot of talk about ranitidine, what we knew as a brand called Zantac. Now it's been taken off the shelves. I don't know if it's been taken off the shelves or it's back on.
Yeah.
Everyone was going, making a lot of noise about it containing something. What happened to that? Yeah,
Well,
everyone's quietened down.
Yeah, it has quietened
Does
down.
the drug company pay governments enough?
No one's come to me and said take ranitidine. Everyone's scared of one thing, but the dosage of it that we were concerned about, this cancer promoting drugs, is so small anyway. Why did it highlight right now? We don't know. But nonetheless, it is still an inferior drug to PPIs. So it's not something we use.
Right. So it was yesterday's drug. Let's keep yesterday to yesterday. In closing, your message to Malaysia: cook well, learn to cook, eat well.
I think eat more plants.
Eat more plants.
Quite simply, if I would say nothing else, eat more plants, because a lot of times the problems with Malaysians is related to the food we eat. You may not know what you're doing. I mean, certainly you'll get WhatsApp messages saying you drink some coconut oil every morning. No, that's oil, still oil, you know. Not sure, ask your doctor, but just eat more plants.
Are you making that move to veganism?
Oh no, of course not. I like my meat, but I'm trying to eat more plants. Okay, just more plants.
On that note, we'd like to thank you for joining us right here on The Nation. We just spoke to gastroenterologist Dr. Prabjot Singh. He's got a fantastic website. We're going to put that on screen for you. It's prabjotsingh.com.
No, it's drprabjot.com.
drprabjot.com.
You got to spell the word doctor.
Doctor, okay, you have to spell it D-R.
No, the other way around. D-O-C-T-O-R.
D-O-C-T-O-R. Prabjot.com. And you'll get all the information you need. He's got heaps of videos there, fantastic videos. Go look at these videos and get more information about gut health, because gut health is so important. What goes into your mouth and what comes out of it is always very important. With that, I'm Jared Ratnam signing off. You have a great day ahead, and thank you very much for staying with us right here on BERNAMA TV.